Hi. How do we assess people's grip strength? So how strong you are in your grip makes a big difference to how you are in your everyday life. So if you can get the lid off your jar, if you can open tight water bottles, if you can lift the kettle, all of those things come down to the grip strength in your hand. So your grip strength actually comes from 50% of muscles that are inside of your hand. So they're very small little muscles, but 50% come from these muscles up in your forearm as well. So how we assess it is we actually want to test both of those muscle groups at the same time. And we use this gadget here. Now this one is called a dynamometer. We just call it a grip strength tester. And what we do is it's got a gauge on it. The handle doesn't move. And it feels quite funny to squeeze, but what it does is it actually is a gauge that tells us how much force you're putting through. So we get people situated, and you need to have your elbow at 90 degrees and tucked into your side, so that then you're making sure that you're using all of the muscles that you need to, and I'd also make sure that we're testing it in the same way every time. So then you squeeze as hard as you can, and then we check how strong it is. I need to go to the gym a little bit more. And then we also then test the other side. So you might have an injury on one side, but we always test both sides so that we get a better, and we do that 3 times each so that we get an average for what's normal for you. Now, that's how we test the grip strength. And then we have norms that we use. So there's been a lot of researchers that have tested how much strength a woman should have when she's between this age and this age, and or how much strength a man should have between this age and this age. We tend not to use those too much in our clinic, simply because there's a lot of variation in that between whether or not you have a job at a desk, or whether you are a fencer or a labourer, or whether you are working manually compared to not working manually. So we tend to like to use the opposite hand as a nice little tester for us. So the opposite hand, your non-dominant hand, will be a little bit weaker than your dominant hand, about 10%. So we take that into account when we're doing our testing, but it gives us a really nice idea of where you should be at, along with you telling us that whether or not you feel a little bit weaker or pretty much the same. So that's how we test grip strength.